and welcome to the program Health and Wellbeing. I am Lois Apasambu. In recent years, Nigeria has been witnessing a concerning trend, which is the departure of its skilled and dedicated health workers in search of greener pastures overseas. This growing phenomenon, often referred to as the Japa syndrome, has significantly implicated the country's healthcare system and the well-being of its citizens. The Japa syndrome is a phenomenon which individuals, particularly young people, choose to leave their home country, typically Nigeria, and relocate to other countries in search of better opportunities and living standards. This term gained popularity through social media and is often used to describe the growing trend of Nigerian youth emigrating in large numbers. This brain drain has had a significant impact on the Nigerian healthcare system, resulting in a shortage of doctors and a strain on the delivery of quality healthcare services. However, there is untapped potential in the form of Nigerian doctors in the diaspora who can play a vital role in turning around the tide and revamping the Nigerian healthcare system. To discuss this with me today in the studio is Dr. Douglas Okor, a consultant neurosurgeon with the Federal Medical Center Abuja, and he is also an advocate for the Nigerian healthcare sector reform. You're welcome to the program, sir.
Thank you, Lois, once again, and also thank you, ASO Radio and TV station, for having me once again.
And we're always glad to have you, because the conversations are always driven towards having change, in the Nigerian healthcare system.
Absolutely.
Yeah. So talking about the Japa syndrome, it's not only in the healthcare sector, but we're talking health, and it really impacts us most especially because health is everybody's business. How would you assess the impact of the brain drain in the Nigerian healthcare sector so far?
I think, Lois, like you rightly said, it's across all sectors. A significant number of young people, young middle-class people, they are at this particular point in time, and probably for the last couple of years, they've been thinking, hey, if I could actually get the opportunity to actually leave Nigeria and go to somewhere else where my skills will be relevant, where my skills will be appreciated, where I will get better remuneration and stuff like that. So a significant number of people actually have that. And there's what they call the NOI polls, the Ngozi Okonjo polls and stuff like that. So they did the polls at one point, actually asked questions to a couple of doctors, and they found out that up to about 88% of them were thinking that they would love to leave Nigeria if that's possible. So that's quite significant. How has it impacted on us? Absolutely, it's impacted on us significantly. When you look at in terms of the kind of individuals, groups that actually have competence, knowledge, skill, and stuff like that, especially within the healthcare space, and you look at the significant numbers of those kind of people leaving your shores of your country, it's definitely going to impact. Okay, and it's going to impact significantly across board in terms of when you look at the some of the sectors or segments of the healthcare system. Remember, the healthcare system has different components.
Yes.
Right? So if you look at the human resource for health, for example, okay, it's going to impact in that you're going to have a situation where you're having a significant, or you've had a significant number of not just doctors. Remember, I keep saying, everybody keeps talking about doctors, okay? But if you look at the whole cadre of healthcare professionals within the healthcare space, all the way from midwives, nurses, radiographers, and stuff like that, all the way up to doctors and nurses as well. All of them have been leaving. Okay, so when you look at the numbers with respect to what ratio of nurses to the population do you need, what ratio of doctors do you need, what ratio of midwives, what ratio of physiotherapists and stuff like that, definitely we are nowhere near what the World Health Organization standards should be. So there's an impact from that point of view. Of course, there's also an impact in the service delivery itself. Okay, if you should have one nurse. Okay, let's take a ward in one of our public hospitals. Okay, you have a ward that has maybe like 60 patients. Okay, and you now think, okay, in a normal ward, like how many nurses should you have looking after the patients at a particular point in time? Of course, if you go round across board in the whole of the country looking at all our public hospitals, you'll find that you have significantly reduced number of nurses on the ward. And of course, if you try and relate that to the quality and the safety of the kind of care that
they provide,
The answer is clear. So has it impacted? Of course, it's definitely impacted negatively on us.
Okay, so we've spoken about this, and we have seen, stories of how, because health workers are overworked, you have to run like 3-4 shifts back to back. You don't have time to rest, and we have issues where there are just some mistakes that could have been avoided if this person had rest. But in your opinion, what can we do, to make sure that this is let's start from, for those that are here, what can we do to make sure that we're able to at least augment this issue that we have on ground? Okay, so you're talking about how do you keep healthcare professionals on the ground in Nigeria? Yes.
How do you reduce the Japa syndrome? Okay, it's simple, and of course we've talked about this lots of times. Okay, first of all, like I keep saying over and over, and I'm sure I'm sounding like a broken record now, we must take healthcare seriously. All the key players that are involved in healthcare must take healthcare seriously. Remember that in the Sustainable Development Goals, there are 17 of them. Healthcare is number 3. That's how important it is.
Yes.
You understand? In any society, in any country, healthcare is so important. So we need to actually start from there first. When I say who are the key players in healthcare? Of course, you must always start with the government first. Okay? Federal, state, local governments all working together, integrating. Okay, so that's the first thing. Okay? So leadership, all the key players within healthcare must even say, hey, we want to actually take healthcare serious. That's the first thing. Second thing, okay, you must throw lots of resources into healthcare. Because guess what? One of the key issues that we're having, that's making people say, oh no, I don't like this environment I'm in. I want to go to another environment. Greener pastures. What are the issues? First of all, toxic environment, okay? Stressful environment. All the things you need to work, you don't have them, okay? Coupled with the fact that you're having very few people taking care of a significant more than normally that they should be able to cope with naturally. Okay. Plus, what is the remuneration like? Okay. Plus, what are the other issues that would like someone to actually live a full life? Okay. Housing, security. Okay. So those are a couple of things. But what I'm saying is that funding in healthcare, significant increase in the funding in healthcare will help to actually ameliorate some of these things. Okay. Also, with respect to looking at the individuals themselves, okay, committing resources to actually train them and upgrading their capacity as well is really, really important. As human beings, we always want, the average human being wants to be relevant, okay, and you're more relevant when you're properly trained, okay, when you're trained to a level where you're competitive. For me, at a global level. So those are some of the things that actually need to be done.
Okay, so because when you started speaking, there's one thing that came to mind, and we've always said it on the program. You're one of the few people that used to be abroad, and then it's almost like you're moving against the tide. Everybody's moving to go out, but we're moving to come back into the country, So let's start with the fact, what did you see that made you want to come back to the country? Okay,
so key thing. We've always known that, hey, Nigeria is a sleeping giant, isn't it? Nigeria has massive potential, Lois. Across board in any sector at all, even in the healthcare, has potential. But of course, the question is always, how can you convert this potential? How can you flesh up this skeleton? Okay? And who do you need to do that? You need human beings to do that. Nobody's there. We are very spiritual and very religious in Nigeria. We like God very well. So you're not going to physically see any God that's going to come down and come and do anything. Okay. So it is human beings that are still going to do it. Okay. So who are the kind of human beings that you will need to do it? Of course, the human beings who are on ground, but of course, those people who have left the shores of this country and they've gained significant amounts of knowledge, skill, competence, and stuff like that. If you have those people coming back and being integrated in this system, wow, you will make magic happen. And so trying to get the diaspora or those people who have been brain drained and actually get a reverse or actually get brain regain is going to be very, very important in terms of trying to actually revamp and reform our healthcare system in Nigeria and start pushing towards a kind of healthcare system that we'll all be proud of. So for someone like me, I've basically answered the question. For someone like me coming back, is that good? Is that going to plug any holes? Is it going to actually be any advantage within the healthcare system in Nigeria and stuff like that? Absolutely, it is. And I can tell you, even from on personal level and within my own small ring of influence and stuff like that, I can tell you that in terms of the standards, okay, and the safety and the quality of providing care within my own remit and stuff like that, that's actually improved.
Okay, so let's talk about, now the discussion is fully how we're able to, how should we harness, these brains that have been drained to gain
And
them
regain
back.
them.
Yes,
Okay.
and regain them back. What strategies can we use?
Okay, so the first thing is that if we were able to bring this people back, what will they add to the system? Number one, they will add. There will be some sort of cultural influence. Okay, this initially when I came back to Nigeria, when they say, oh, we have a meeting by 7 a.m. I say, oh, by 7 a.m. Okay, 6:55 I'm there, and then 7 a.m. nobody's there. 7:05, 7:10. Okay, so now we might be laughing, but it's cultural. It's cultural. We have this African Nigerian time and stuff like that. So things like that, things like the ability to actually work in teams with people, things like the ability to actually communicate properly and stuff like that, those are cultural. So one of the things that if you bring such people into our system, you now have this sort of cultural transfer, and stuff like that will be very, very positive and progressive for the movement forward in places like Nigeria. Number two, in terms of building capacity, okay, and training, you need those people. Blah, blah. Now, sometimes the people who are on ground in Nigeria, they get scared of that. Like, for example, even me, I've been back in Nigeria for about 6.5 years. And I'm telling you, for a very long time, I was treated like, this outsider. You understand? So the key thing is that even if you cannot bring people from outside into Nigeria without integrating them with the people who are on ground in Nigeria. The people who are on ground in Nigeria, they actually have their own knowledge, skill, and their own local understanding of what the things are happening here. But what I'm saying is, if you integrate the people who are outside and bring them in here and actually combine that sort of force together, you're going to move places. So definitely, building capacity and training is going to be another very important way. Of course, public-private partnerships. If you look at most of the private players that are doing a fantastic job, especially in complex care in Nigeria, a significant most of these groups and these organizations are actually have people with diaspora returnees. Okay, I know we'll be talking about, but it's not just me. There are significant others. Who have actually. There's what we call the Doctors for Change group. Okay, it's a group of Nigerian doctors who are in the UK, in the US, who have actually come back to Nigeria, who are all interested in actually the healthcare moving in the right direction in Nigeria. So those are some of the couple of things that that are trying to get the diaspora involved in the mix of the healthcare space in Nigeria can actually do. Now, in reality, how should this happen? Okay, we can start looking at some of the components of healthcare and seeing how you can infuse them. First thing is that, okay, let's start with leadership and governance. Okay, one of the things we need in leadership and governance is transparency, accountability, properly organized governance. Okay, we want ministries, departments, and agencies that are fit for purpose. We want a situation where you can actually throw in lots of technology to actually make things seamless and easy and straightforward and stuff. We need our accountability structures, like our regulatory agencies and stuff. We need all of them to actually work properly. Now, one of the things I talked about is that if you bring diaspora people in and stuff, you're going to infuse a new culture, isn't it? You're making a part of it. So these things are also cultural as well. All these issues of transparency, accountability, making sure that things are organized properly, efficiency, effectiveness and stuff. These are cultures. So if you bring people who, for the last 30 years, 15 years, they've been in a particular locale, and that has been their culture, and you infuse them and actually bind them to what's happening in Nigeria, you're going to be moving towards that, isn't it? So that's how they can get involved in leadership and governance. Funding and financing. Well, a significant number of people in that, this is just general, a significant number of the people in diaspora have families in Nigeria. So when you look at things like even trying to support some of our insurance systems and here and stuff like that, you can actually get that as well. But like I said, remember, part of funding and financing, especially when you look at innovative funding and financing, is the public-private partnership, isn't it? And I've told you that when that private sector that is actually doing a yeoman's job, especially with tertiary and complex care, a significant number of diaspora returnees are there. So you can see how they can actually link up with that. Thirdly, we talk about the human resource for healthcare workforce and how you can actually strengthen that. And I'm saying that if you have these eggheads, okay, in places like UK, US, Canada, and stuff like that, and those people, you actually strategically infuse those people into the building of the capacity and the training of the whole cadre of staff within our healthcare space. Wow, you can make magic happen in terms of just building the capacity across board. Okay, so those are some of the ways you can actually throw that in. But key thing is that if you want to make this really work to a point where you can actually scale and it's making a true impact within the country's healthcare space, do you understand? Then it has to be very strategic and organized. Okay, now again, you have that diaspora people getting involved in stuff, but it's just
randomly.
It's randomly. This one is doing its own thing there, and I won't lie to you. There are some people who are on ground, are coming from diaspora and doing an absolutely fantastic job. I don't want to mention names here, but do you understand? Maybe I should, like for example, like the monitor healthcare. Fantastic job that Dr. Femi Oguremi is doing. You understand? Going around, doing lots of advocacy. You understand? Doing even things like preventive care for cancer, doing like cancer screenings and stuff like that. Doing lots of training for basic life support, advanced life support and stuff like that. The Loretta Health Initiative by Loretta Ogboro Okor. My wife, she's a gynecologist. She's now in Edo State doing lots of work at the grassroots to try and actually help provide at least health checks and actually basic health care for people. Okay, now like I said, there are many people doing their things that are in a scattered way and stuff like that, but by the time you actually get governments involved and governments are really serious and they start coordinating this and they start doing it in a strategic way and stuff like, wow, you can get super scale up, you understand, that will actually help change things at the tide of our healthcare system.
Okay, so there's one thing I always like talking about, and that's our primary health care. You know, so because when we speak about, brain gain, most of the times it's just like you said, quite a number of them come back to do complex healthcare, and that's most times in the tertiary institutions, very few times in secondary institutions. Primary healthcare, no, we don't even have hope, because even at the moment right now, so many primary healthcare centers do not have doctors attached to them. It's just the community health extension workers.
You know, because I've asked you, must you have doctors attached to them?
Well, because we have, okay, so let me ask then, because you're the doctor and you're the expert. Good. Isn't every primary healthcare center supposed to have a doctor attached to them? Okay, so
remember, there's what they call the ideal, isn't it? That's what they call the ideal. But even when you're thinking of the ideal, you must actually ask yourself, hey, we are in this circumstance now. How do we pull ourselves out of this? Can we think innovatively and try and push ourselves out of this? Okay, how many primary healthcare centers do we have? Okay, in the almost 10,000 wards, for example, in Nigeria. Okay, how many do we need? How many doctors do you actually have in Nigeria? Okay. And so you must start thinking laterally. That's why you talk about the community health extension workers. Won't you be happy to go into a primary healthcare center, for example, with very well-trained community health extension workers that can still provide that care for you? Okay, so you're absolutely right that there's a tendency for, when you look at the diaspora inputs within our healthcare space, for it to be at more of the tertiary level, okay, and maybe a little bit to the secondary level and stuff like that, and not much is happening at the primary level. Now, guess what? If you now have governments at federal, state, local government that really working together and trying to integrate their approach to healthcare, you can now actually use this diaspora. You understand, this diaspora muscle they actually have to actually, transform things at the primary healthcare center. Remember, I talked about technology. Okay, I talked about technology. You have this iPad now and stuff like that. You know that you can actually have systems that can talk to each other and stuff. As long as you have data in that village where the primary healthcare center is, and you have the community health extension worker and so on, you can link that person up to someone anywhere who's remote anywhere. That's why technology is absolutely fantastic. And you can actually make magic happen with respect to the quality and the safety of care they're actually providing to those people in that rural area.
Okay.
So it's possible.
Of course.
But what I'm trying to say, the missing link here is that governments are not taking. See, I've heard most of the guys who, especially the guys in the Doctors for Change and stuff like that, or people who are in private sector, their baseline stance is like, oh, government, whatever has to do with government, they are not serious and stuff like that. But guess what? While they are doing a good job, those private people, the only people they can serve are just a very small number of middle class people, who have the resources. Okay, and I keep reminding anybody who cares to listen at all, and if nobody takes anything from this interview, take this. If you truly want to actually, send out that, at least that basic modicum of quality and safety to care for the average, those 133 million multidimensional people who are more in rural areas and stuff like that, you cannot do it without government. It cannot be done. Okay? And so, That's why this last election, when you had young people coming and people really interested in who's going to govern us, what are they all about as well. That's why it's really we are moving in the right direction. Okay, with regards that you cannot build this country up, any sector, specifically healthcare, that is so important without government intervention in terms of if you want to scale up and truly deliver care to the people. You cannot.
So now, speaking about the primary healthcare system, I'd like us to talk about what systems can we leverage on, you know, as a country to see how we can build this.
Okay, so key thing is this. Again, like I'll repeat this. Governments must be involved. They must actually get these people in a very strategic way, in a very preemptive. You know, when you're not doing things like, let's hope that you just fall in place. No, you're actually very deliberate about it. Okay, and then you're looking at numbers. Okay, which kind of diaspora people do we need? Okay, when we talk of diaspora, there's a tendency again for us to really think doctors. No, there are other healthcare professionals, radiographers, physiotherapists, and stuff like who are outside. Now, guess what? Do you know there are also a pool of Nigerians who have been in the US, UK, Canada, or whatever, and are retired? They're actually retired, they're receiving their pension. They won't mind actually coming to actually provide and actually help support and stuff like that. Okay, but what I'm saying is that you must have interventions by governments that is actually very structured and very strategic to actually pull this people in and actually start doing it in such a way where they're actually supporting primary care, for example. And one of the, like I said, one of the ways you can use technology. So, for example, if you have someone who is a retired family physician from the US, for example, who's done lots of work in the US and stuff like, he's retired and stuff like that, that kind of person can actually be in a rural area, in the local government, for example. Okay, maybe in that local government you have maybe like 3-4 primary healthcare centers. Be in the center of that local government, okay, and is doing training and support for all the community health extension workers, okay, with technology. That's a possibility. And that will now mean that whoever is going into that primary healthcare center to actually access basic healthcare will be getting real good service. Okay? So, but what I'm saying is that to actually get to this point, you must have a serious government. You must have all the key players coming to the table and say, hey, we truly want to actually deliver this kind of thing. Because the Nigerian patients are worth it. These eggheads, these people who are in the UK, US, or whatever, these diaspora healthcare people and stuff, especially, like I said, different categories of them. I've talked about one, the ones who are retired, okay? Do you know that within their workplace, most of these healthcare providers or professionals in the UK, US, and in the diaspora, they have this. They have a space for things like sabbaticals, for example. Yeah. They have space for that. Okay, so I'm telling you, lots of Nigerians abroad with that 1 year sabbatical or 6 months or whatever, they won't mind coming to spend it in Nigeria and trying to support what we are doing here. But I'm saying it has to be coordinated from the government level. The government is still the best way to actually coordinate and organize and structure this thing. Of course, working with the private sector as well. So I'm just trying to give you an idea in terms of a breakdown of in real time in the field how you can actually help to actually change things around by actually getting the diaspora involved to actually raise the bar.
You've spoken a lot about technology. You know, you keep saying there's technology. So I'd just like you to give us a better insight, you know, of how we can use technology to our advantage. Okay,
technology. Your phones. You can talk. You can do videos. You can take pictures. Okay. Once you can talk, you can do videos, take pictures. What's remaining? Of course, you actually have systems that can talk to each other. You want a system as simple as your email. If all of us have emails here and I send an email, it gets to everybody, isn't it? So that means you can actually build systems where someone is in a primary healthcare center, a community health extension worker, he's seeing a patient, this patient is a little bit difficult, he just types something on the system, and then the doctor who is in the local government place actually sees that, okay, can you take a picture for me and let me see that stuff like that. I'm just trying to break it down. Okay, technology can help us leapfrog most of the issues that we have. Okay, and actually help to actually deliver a better service, especially to the rural community and especially to these 133 million multidimensionally poor people who what they are struggling with is just access to basic healthcare and basic education. I hope that makes sense, Lois.
Yeah, it does. Yes, it does. You know, because I've been to, like you are with FMC Abuja, you know, and I've seen a little bit of the use of technology, and I'm like, okay, this is interesting. You can just fix your appointment dates, it's sent to the doctor, you don't necessarily have to go and line and queue and all of that. And I've seen it work, you know. And it's good because it's a tertiary institution. So it mostly seems like tertiary institutions and secondary institutions get more, resources than primary healthcare centers.
Which is not supposed to be. which is not supposed to be.
Yeah.
And one of the things I've been advocating, anybody who has listened to me who cares to this, I've been saying, can we spin that around a little bit? Can we get more resources for primary healthcare? Because it makes more sense. It is cheaper, it is better when it comes to things like promotive healthcare, preventive healthcare, and stuff like that. It is much more cheaper. I'm telling you, that old man, that 80-year-old man in your 65 to 80-year-old man in your village, okay, it's better to actually control his high blood pressure and control his diabetes in that primary healthcare center there than when he actually has a stroke and has a bleeding into the brain and now comes to the tertiary hospital, and then you are looking at the patient and say, okay, it's going to cost about 2.5 million for your care, and like 2.5 million. We don't even have money to feed and stuff like that. So again, back to me, we must invest in our primary healthcare system. The federal government, okay, you know this thing about primary healthcare system is within the jurisdiction of local governments. Can we please stop that? Can we stop that? Okay, even if it's within the jurisdiction of the local government, the federal government, who has more financial muscle, must, as a sense of duty and understanding that healthcare is this important and Nigerians are suffering in their numbers, must, as a point of duty, now really focus on primary healthcare. And like I said, we were talking about diaspora, actually in a structured and organized manner, get the diaspora involved and things will take a turn for the better. Lois.
So I know you have experienced a lot, and just like you said, when someone from the diaspora comes in the country, it's almost like this person is high up there, this person is not someone we can approach, and all of that. And there's almost like this.
It's an issue of we can approach. It's always like, hey, you, where have you been since? You that's been enjoying since we've been on ground. Please don't come and chop our food. Leave. It's not even an issue of you're high up there. No, it's an issue of you're an outsider. Okay, please, I'm begging, can we please change such attitudes? Such attitudes will not help us in the short term, medium term, or long term. Okay, this thing that I don't know whether it's the poverty in the country that makes us not to actually. That's what I call critical thinking. Your ability to actually look at this and say, hey, this is black, this is white. Okay, it's very difficult in this part of the world. We are so emotional about things. The ability to actually critically analyze and say, no, this is what this is so difficult. Please, Nigerians. Can we, when we see something that can actually benefit, especially us, but as a whole, as a generality, can we please plug into it? Okay, this forgive me, nonsense. About he's from my religion, he's from my ethnic group and stuff like. Can we please play that down a little bit, because whatever is affecting us, do you understand, is affecting all of us. Whether it's a poor healthcare system, whether it's the issue with infrastructure, whether it's the issue of a poor educational healthcare system and stuff like that. So please, all this thing of trying to do like, no, he's not a part of us as well, it will not help. Whether you like it or not, like I said, you cannot take the people from diaspora and replace people who have been on ground in Nigeria. But you need them. Why do you need them? Because you cannot change it. These guys are very experienced, they are very knowledgeable, they are super competent, they've been trained very well. And so if you have that pool of talent, please use it to the benefit of Nigerians.
So I think about 2 years ago, I did this report on, the exodus of Nigerian doctors from, Nigeria, and Saudi Arabia even bringing their recruiters to come and take, and then I expected that government would do something drastic, I expected that this was something that would make government move and, okay, what can we do? How can we fix it? But I think a few months after, it was even in the middle of a strike that happened. There was the National Association of Resident Doctors had even gone on a strike. And there was even a strike at then. And even when this had happened, a lot of media outlets had reported it. Nothing was done. In fact, the strike continued for about a few weeks before it ended. And it was almost like that's it. But I'd like us to play that report and see, then we'll discuss about how grave this is and steps on and solutions on how to get it right in the Nigerian healthcare system. Medical doctors in various fields such as anesthesia, ICU, pediatrics and surgery, family medicine, obstetrics and gynecology, amongst others, were required for the recruitment of doctors to Saudi Arabia. Some of the doctors who spoke lamented the poor conditions of service, poor investment in the health sector, inconsistent salary payments, amongst others.
The people in charge, the members of the cabinet, the labor minister, the health ministers, both of them are doctors, they are medical doctors. I'm sure NAT has represented me, all my grievances to them, and I'm sure they have more experience than I am. They are very much aware of how poor the health system is being run in the country. No insurance for doctors, no insurance for other health workers. and the risk the doctors and other health workers are exposed to worth more than the allowances given to them. I'm sure if they can profound a way or solution to the hazard being exposed by the doctors and the other healthcare workers, I'm sure it will go a long way. Apart from the remuneration, the poor remuneration, I mean.
Further investigation revealed that the doctors required were consultants and senior resident doctors with experience. Speaking anonymously, one of the doctors said, if consultants who train resident doctors want to leave, what is then left of the health sector in the country? Recall that the Nigerian Association of Resident Doctors has been on strike since the 2nd of August 2021. However, despite numerous negotiations between the government and the association and the intervention of the National Industrial Court, these issues are yet to be resolved. Many amongst their demands are the main reasons why most of these doctors say they are leaving. Welcome back, and that was a report just giving us an idea on the situation of Nigerian doctors leaving the country. But because Nigerian doctors are leaving the country does not necessarily mean that that's the end. There is always a positive side to everything, and that's why I'm here with Dr. Douglas Okor, and we're talking about how we can use this to our advantage. We've spoken about technology. I'd like us to speak about policies. What kind of policies need to be put in place? You know, stopping, we've already spoken about stopping, them from going, but okay, what kind of policies can we put in place to make sure that, one, it reduces, and two, we can bring more of these people back? And because, there was this, in the Ninth Assembly, there was this member that had actually come up with a bill to stop to stop, Nigerian doctors from leaving the country because education is subsidized in Nigeria. How can Nigeria train you and then you'd leave? What kind of policies do we need to put in place?
I think I've gone through this over and over again. Let me go back to the one that you talked about. The Saudi Arabian guys coming to recruit here and stuff like that. See, it's simple, okay? If you make your house a dustbin. Anybody who is walking past with debt will come to your house and throw it and make it a dustbin as well. Okay? You have to respect yourself before people from other places start respecting you. Okay? I've tried to explain some things. 153 million multidimensionally poor people, and part of their poverty dimension is access to basic healthcare. I've talked about 17 sustainable development goals, and guess what? Healthcare is number 3. Okay? Our governments and all the key players, we've not been taking healthcare serious for a long time. And I'm saying that needs to change. And how can that change? No, with the politicians that I know, they are not going to all of a sudden one day, hey, have a light bulb and say, okay, we've seen the light. We're not going to start really investing in healthcare. No, you must put pressure on them. Okay, that's why you see me, apart from talking to you, I'm on Arise TV, on other stations, talking about the same thing too. And we need more people to be talking about this and putting pressure. Okay, if you do not make healthcare a mainstream issue, just the way you've talked about it, where this happened and like 3-4 months later, everybody it office, that's what's going to happen. And of course, you talked about the issue of in the National Assembly and the guy from the House of Rep bringing a very simplistic and there's a very basal bill to the floor and stuff like that, and looking very unserious. Do you understand? And looking like someone who doesn't understand the fundamentals of what trying to actually build up a healthcare system is all about. You cannot stop anybody from going anywhere, okay? But you can recreate the environment to make sure that the environment is suitable for people and say, I would like it. Do you know that the average person in this world would like to stay where they are born and where they are from? The average Nigerian would prefer to stay in Nigeria. Do you think if there was proper light in Nigeria, roads, security, the hospitals work very well, it's a very good environment, you think Nigerians want to leave? I got into UK in 2006. Okay, spent about 10 years, completed my training before I actually came back to Nigeria. Do you think I was enjoying staying in UK? Absolutely not. If you have just about 40% of what you have in places like UK or US in Nigeria, in terms of the environment and so on, a significant number of people will come back. Oh yes, please put that out on air. A significant number of people will come back. So there's work to be done when it comes to building our economy, focusing on healthcare and stuff like that. So when we talk about policies, we don't have any issues with policies or laws. So there are plenty of good policies on the ground. Okay, but the issue of, from a political standpoint, having the political muscle, having the right mindset to actually say, hey, let's actually drive this policy in such a way that we actually implement them in such a way that it actually impacts positively on the lives of people across board in Nigeria, all the way from the high class, the middle class, and those 133 million people now multidimensionally poor. Do you understand? Then you can start actually making some changes. Our governments at all levels have not shown that they care about Nigerians. And that is the truth. Let's not deceive ourselves. So when you're talking about specific policies, there's no need to actually worry ourselves about specific. I've talked about some of them already. Okay? Policies where you actually improve the funding for healthcare. Policies that actually, do you understand, reform our ministries, departments, and agencies to make them fit for purpose. Okay? Policies that actually push, do you understand, the training and retraining and building the capacity of our healthcare workforce. Okay, policies that actually put in place in terms of structure, in terms of having a proper environment, water, light, and stuff like that for especially the primary healthcare centers and stuff like that. Those are basic common sense things. But why are they not happening? They are not happening because there are some people are just so lazy. Do you understand? All they just do is just go to a place and, from a selfish point of view, just amass wealth. But when it comes to the issue of actually driving these things home and actually making them work for the average Nigerian stuff, it's not happening. Again, like I said, Lois, you're not going to have a situation where these guys just have a light bulb and say, oh, do you understand? We've seen the light, we want to not change and stuff like that. You must put pressure on them. Okay, sustained pressure. I call it positive pressure. That's what I call it. You must put pressure on them. Because the Nigerian patients are worth it.
Yes, Nigerian patients are worth it.
Absolutely.
And you talk a lot about training and retraining. And the times I think I've seen a letter of a community health extension worker send a letter to, I think, a doctor, a referral letter, and it was almost like that person could not write well. And there was so much argument over and over again about how some of these workers are not even well trained, of how these workers are not even, should I use the word certified? Maybe they just go to school. And over time, I'm from Kaduna State, and I've seen quite a number of private institutions set up health technology colleges, a few health colleges and all of that. And quite a number of these community health extension workers graduate from this place. What can government do to make sure that these places are more standardized for us to have at least quality health extension workers if we're not going to start?
I like it that you always ask questions I've answered already, but I like, repetition is the hallmark of learning. So I like repeating myself over and over again. One of the things I talked about is that let our MDs, let them work, let them be fit for purpose, isn't it? I picked out a particular one of them and I said regulation. Okay?
Yeah.
So with regulation, you have standards. There's going to be a standard. Whoever you are, community health extension worker, physiotherapist, radiographer, doctor, nurse, whatever, you must meet a particular standard. Must. Okay? And so that means, in terms of even funding and putting resources, I would like to see a Nigerian government at federal, especially at federal level, and of course dovetailing into state level, where you're actually putting proper funding into regulation and regulatory bodies. Can they please do their work? They need to do their work. If you go on the General Medical Council website, which is the website that regulates doctors in the UK, so that you can see everybody's name there. Everybody. All the doctors. Okay? So if you have that in Nigeria, for example, or just imagine the community of extension workers, okay? They are all properly trained and properly regulated. You're sitting in front of a community of extension worker. He probably has a badge. Maybe his number is there and stuff like that. You can look at his name and look at his number and just type on this thing and actually check him out and stuff like that. Please, what is so grand about that it cannot be done? The problem is that our governments and all the key people who should be interested in different sectors, especially healthcare, we have not been serious for a long time. That's why I've coined that word, serious government. Serious government. When a government and the people, when they are serious, I'm telling you, Lois, you will do. You will feel it. You will see it. We've been too unserious for a very long time in this country. Can we please start turning that around? Please.
Okay, thank you very much, Dr. Douglas, for taking our time to be with us on the program. And I always like your energy because I see the passion, honestly, in trying to make sure that this healthcare system is fixed, because it's not rocket science. In the end, it's not rocket science. But as we wrap it up, I'd just like you to give your last words, before we wrap it up on the program. So
basically, the diaspora, okay, in every sector in Nigeria, you need the diaspora, okay, to actually come on board. But for this to happen in a very structured and organized way, you need governments to actually do it. And with getting the diaspora input in our different sectors, specifically healthcare, since we're talking about healthcare, we will go places in quickly. That's what we're doing, in good time. And we need the diaspora, or we need everybody on board, all the key players, because like I always say, Lloyds, the Nigerian patients are worth it.
They're worth it. Thank you very much, Dr. Douglas.
Thank you.
We sincerely appreciate your presence.
Thank you.
And our very short message to our leaders. Nigeria has a valuable resource in its Nigerian healthcare workers in the diaspora who can play a transformative role in revamping the Nigerian healthcare system. By strategically engaging and leveraging their expertise, knowledge and experiences, Nigeria can tap into their vast potential to address the challenges of brain drain and strengthening the healthcare system. Well, thank you very much for joining us on the program today. Please do keep it a date with us same time next week. I am Lois Apasambo. Do stay safe.